A patient was diagnosed with a space-occupying lesion in the posterior cranial fossa at the hypoglossal canal. Which of the following muscles will most likely be affected? Here we can see the hypoglossal canal from the inside of the posterior cranial fossa. It is located just above the foramen magnum. In another view, from the base of the skull, you can see the location of the hypoglossal canal again, located above the occipital condyle. You may imagine that the hypoglossal nerve, as it arises from the skull through the hypoglossal canal, will be in close proximity to the first cervical nerve, which leaves the spinal cord and the vertebral canal above the atlas vertebra. I will come to this point in a moment. Here is a sagittal section of the mouth showing the mandible and the hyoid bone. Geniohyoid muscle, the first option, is situated superior to mylohyoid, the second option. It is named for its passage from the chin, genio meaning chin, to the hyoid bone. So it extends from the chin to the hyoid bone, and so it is geniohyoid. I will represent the hypoglossal nerve as it arises from the hypoglossal canal by this interrupted line. Close to the hypoglossal nerve, below the foramen magnum and above the atlas vertebra, arises C1 nerve. The anterior primary ramus of C1 nerve hitchhikes, that's to say travels as a passenger with the hypoglossal nerve. Fibers of C1 will form a branch which is called the descendens hypoglossi, or the superior root of the ansa cervicalis, which descends to meet the descendens cervicalis, or the inferior ramus or root of the ansa cervicalis. The inferior ramus of ansa cervicalis is formed from C2, anterior primary ramus of C2, and C3 spinal nerves. Both together, they form the inferior root of the ansa cervicalis. Ansa means loop, and the ansa cervicalis supplies infrahyoid muscles, including the omohyoid, sternohyoid, and sternothyroid muscles. Another similar branch from C1 goes to thyrohyoid and geniohyoid. Therefore, geniohyoid is supplied by a branch from the hypoglossal nerve, but the cell bodies of these nerve fibers lie in the anterior horn cells of C1 segment of the spinal cord and not in the hypoglossal nucleus of the medulla oblongata. These fibers of C1, they join the hypoglossal nerve after it exits the hypoglossal canal and would not be affected by a space-occupying lesion in the posterior cranial fossa. So the first choice, geniohyoid, is wrong. The second option, mylohyoid, this muscle is more or less horizontal. It forms the floor of the mouth. You can see in this sagittal section that the muscle forms a sort of diaphragm. What is above it is the mouth, and what is below is the neck. Mylohyoid arises from the mylohyoid line on the mandible. The fibers of mylohyoid run towards the midline and are inserted into the body of the hyoid bone, and the muscles of the two sides meet in a midline raphe. Below the mylohyoid is the anterior belly of digastric. The nerve to mylohyoid supplies both the anterior belly of digastric and mylohyoid muscle. This nerve to mylohyoid, arises from the inferior alveolar nerve in the infratemporal fossa. You can see here in the infratemporal fossa, this is the posterior division of the mandibular nerve, giving the inferior alveolar nerve that passes into the mandibular canal, and before doing so it gives the nerve to mylohyoid, which descends down to supply mylohyoid and anterior belly of digastric muscles. Here on the inner aspect of the mandible, the inferior alveolar nerve passes into the mandibular foramen, and before doing so it gives a branch that grooves the bone and descends down below the mylohyoid line, and so it will be in the submandibular and submental region to supply the anterior belly of digastric and mylohyoid muscles. Therefore, mylohyoid is not supplied by the hypoglossal nerve and would not be affected in this patient. Regarding the third choice, middle constrictor, you can see here in a posterior view of the pharynx the three stacked muscles, superior, middle, and inferior constrictors, three pharyngeal muscles. All the muscles of the pharynx derive their innervation from cell bodies in the nucleus ambiguus in the medulla oblongata. The motor axons from this nucleus leave the brainstem in the cranial root of the accessory nerve and pass to the vagus nerve within the jugular foramen. The vagus leaves the skull through the jugular foramen together with the glossopharyngeal and the spinal root of the accessory nerve. The vagus has a pharyngeal branch which forms a plexus of nerves called the pharyngeal plexus. This is a nerve plexus that supplies all the muscles of the pharynx except stylopharyngeus, which can be seen here, and it is supplied directly from the glossopharyngeal nerve. So the middle constrictor is supplied from the pharyngeal plexus through the vagus, which carries fibers from the cranial root of the accessory nerve that are carried from the nucleus ambiguus, and it is not supplied by the hypoglossal nerve that passes through the hypoglossal canal, and the option is wrong. Regarding option 4, palatoglossus, this muscle arises from the undersurface of the palatine aponeurosis in the soft palate, and it is inserted into the side of the tongue, raising a ridge called the palatoglossal fold just anterior to the palatopharyngeal fold. In between these two folds, palatoglossal and palatopharyngeal folds, is the tonsillar fossa. The palatoglossus muscle is therefore a muscle of the palate. The muscles of the palate, as well as those of the pharynx, are supplied by the pharyngeal plexus except for the tensor villi palatini. This muscle is supplied by the mandibular division of the trigeminal nerve, nerve to medial pterygoid muscle, which also supplies tensor tympani. So palatoglossus is not supplied by the hypoglossal nerve. Regarding the last choice, genioglossus is an extrinsic muscle of the tongue that arises from the superior genial tubercle behind the front of the mandible. Its fibers fan out to be inserted into the whole length of the tongue. It can thus be used to protrude the tongue. It is good at this point to recall the muscles of the tongue and their innervation. The tongue has extrinsic and intrinsic muscles. The intrinsic muscles are responsible for changing the shape of the tongue, while the extrinsic muscles, they change the shape and position of the tongue. The extrinsic muscles of the tongue include genioglossus, styloglossus, and hyoglossus. The other glossus muscle, palatoglossus, is considered as a muscle of the palate as far as innervation is concerned. All the muscles of the tongue are supplied by the hypoglossal nerve, except palatoglossus, which is actually a muscle of the palate and is supplied by the vagus through the pharyngeal plexus, as has been mentioned. Therefore, option 5 is correct. Genioglossus, being supplied by the hypoglossal nerve, is the most likely to be affected in this patient. The two sides of the tongue are independent in their nerve supply. So if, for example, the left hypoglossal nerve is damaged, then genioglossus on the right can protrude the right half of the tongue, but genioglossus on the left will be paralyzed. Thus, when the patient is asked to protrude the tongue will deviate to the left, that's to say, to the same side as the lesion.